Good afternoon. My name is Intapat Nativatana. My topic to talk today is anti-diabetic drugs. The outline to talk today is type 1 and type 2 diabetes mellitus and pathophysiology of diabetes mellitus. The second is the insulin in production, control, releasing, and function. And finally, we talk about the importance of the anti-diabetic drugs. They have a big two types, the injection insulin and the oral anti-diabetic drugs. After finished in this lecture, you will understand to explain the insulin production and function, explain the diabetes mellitus type, pathophysiology of diabetes mellitus, and finally, you can explain the underlying mechanism of injection insulin and anti-diabetic drug is oral. Why do we use the drug? Normally, we use the high import of the drug to use too much today, but is important for your life or not? We have explained the normal function of the organ by homeostasis. It's a normal physiology of the body. They have insulin. After you take the meal, the blood glucose are raising. The pancreatic beta cells produce the insulin. The insulin can uptake the glucose from outside to the inside the cell for fast metabolism and produce the ATP adenosine triphosphate to produce the body and maintain the blood glucose level. If they're too much, they call the pathophysiology because when to produce the disease in this case is diabetes mellitus. They have two types. The first type is from the genetic. We found in the youngers more than older and may be produced sometimes from the autoimmune disease. They have a low level of the insulin. And the type 2, they have a normal level of insulin, but the receptor and sensitivity are decreased. They have effect too much and produce the adverse effect to the body. And body cannot compensate in this process. It's important to use the drug to maintain the homeostasis of the insulin. So the drug important to use in this case. What is diabetes mellitus? From the World Health Organization definition that diabetes is a chronic metabolic disease characterized by elevated level of blood glucose or blood sugar, which lead over time to serious damage in the heart, blood vessel, eye, kidney, and nerves. I talked to you before, they have two types. The type 1 is called the insulin-dependent diabetes. It depends on the insulin because the beta cell did not produce the insulin by destruction from the immune. They destruction the beta cell in the pancreas. They can found in the child or younger peoples. The type 2 diabetes they call non-insulin dependent diabetes is maybe a normal level or lower or higher, but insulin resistant in target organ, such as the muscle and liver cells. Insulin level may low or normal, but affect the insulin secretion. We try to focus in the liver and muscle because they have a main metabolism of the body to use the sugar as the energy. They have effect too much in a diabetes mellitus in your body. They can risk of stroke from the insulin, and they found the kidney is failure because they try to withdraw the insulinase destruction in the kidney, and they may produce the are conscious, they affect the neuron. The neuron cannot function. If you cannot feel from the fingers for the foot, and when you have a wound or your injuries from your skin, it's very hard to healing. This is the effect of diabetes mellitus. The criteria now for the diagnosis of diabetes mellitus, we use the chemical lab into. The first is fasting blood sugar or fasting plasma glucose. They have 126 milligram per deciliter 8 hours after meal. If higher than this, it represents that you are diabetes mellitus. And the second is hemoglobin A1C, much more than 6.5% of the body. Normally, after the glucose was uptake after the meal, they can binding the hemoglobin. Is a protein in the red blood cell. You know that the red blood cell is not the nucleus. They have a biconcave shape, and we use the energies from the glucose by binding by the glycosylated method. We have a three types: is hemoglobin A1A, hemoglobin A1B, and hemoglobin A1C. But we focus only the hemoglobin A1C because they have higher than the two types. And we can find that the red blood cell have a 126-day old, is alive and be destroyed in the spleen. They can represent that how long the sugar accumulate in your body. The insulin is a hormone, is the amino hormone that produced in the pancreas is the lysis of Langerhans, which regulate the glucose in the blood. The lack the insulin caused from the diabetes mellitus. Insulin composed of the 51 amino acid linked to peptide chain with the disulfide bond. They produce in the beta cell with the pre-proinsulin and become to change to the pre-insulin in the endoplasmic reticulum and storage as a granules of the insulin. Insulin secretion by the various from the neurotransmitter, but normally if the glucose was uptake in the cell by the glucose transporter, they inhibit the sodium potassium ATPase pump, and the calcium was efflux into the cell and insulin was released from the cell. Calcium is very important factors that affect the insulin secretion. The insulin secretion may be signaling transduction to induce various effects, but the important is induce the glucose transporter. The glucose is a special molecule that needs the specific receptor to come inside into the cell is the glucose transporter. After insulin signaling and sent into every body by the blood vessel, they can binding the insulin receptor and send signaling transduction to match to proliferation, decrease the gluconeogenesis, increase the lipid synthesis, protein synthesis, and cell survival, and important is induce the glucose transport into the cell, decrease the level of the glucose in the blood vessel. Normally, we interested in the three organ is the liver, muscle, and adipose tissue to increase the glucose uptake into these three cells. The injection insulin is the first form that I talk. They use in the type 1 and type 2 diabetes mellitus. We have a three separate in the three type. The rapid onset is suddenly regulate insulin suddenly, but the short acting. And the second is intermediate insulin injection. we use together with the rapid insulin to control the level of the fasting blood sugar and hemoglobin A1C, but cannot use in diabetic ketoacidosis or emergency hyperglycemic. And finally, for control the glucose level is too long, we use the long-acting insulin. In the insulin was injection by the subcutaneous from this picture and degraded by the insulinase in the liver and the kidney. So that if the liver or the kidney did not function, they cannot use the insulin. The insulin injection using in the diabetes both type 1 and type 2 after oral diabetic cannot use, or in some case is the anti-cancer anti-diabetic drug cannot respond, and hyperkalemia. Insulin helps to transport the potassium into the cell. The side effect of the insulin injection is hyperglycemia, diaphoresis, vertigo, tachycardia, and death. Some cases in the insulin allergy and insulin resistance, lipoatrophy, and weight gain. They standard inject in 2 times after the meal, in the morning and the evening. But the intensive case is too much, the injection 3 times. And decrease retinopathy or destruction of the retina, neuropathy or destruction of the neuron. The anti-diabetic drug, they can separate by the underlying mechanism is a 4 type today, but they have found in new type of the anti-diabetic drugs. The insulin first is sulfonylurea group. They're binding the sulfonylurea receptor at the pancreatic beta cell. This is the first line group to use in the person who have a diabetes mellitus. In Thailand, the amaryl is used too much. They're binding the ATP sensitive potassium channel in pancreatic beta cell and trigger insulin releasing because it's inexpensive. And they have low side effects such as the weight gain and hypoglycemic. I talk to you first, they're binding the sulfonylurea receptor and release the insulin secretion, but the real mechanism we unknown. The second is the non-sulfonylurea. This is a new group of the anti-diabetic drugs because they found that the some case is insensitivity of the sulfonylurea. They directed binding to ATPase dependent potassium channel, and the calcium was influx and insulin was secretion. They have a low side effect, is a loading blood sugar, nausea, diarrhea, headache, back pain, and joint pain. They have only one in Thailand is lapagnaline. And the second group is insulin sensitizer. The metformin is used in the first line drug together. They have direct and indirect on the liver to the lower glucose production in the gut and increase the glucose utilization by increase the GLP-1. GLP-1 is the glucagon like protein 1 that they induce after the insulin secretion, and they decrease the destruction of the insulin. And they have a common side effect is the nausea, stomach pain, bloating, gas, diarrhea, constipation. The metformin is inhibit the ATP synthetase production in the mitochondria. The next group is thiazolidone. This group is action from past the nuclear receptor, the p-gamma receptor. directed binding to the beta gamma receptor and beta gamma receptor binding to the responsive element in the DNA and induce. The one that they induce is the insulin receptor. They have two groups, it's a roxitazone and proglitazone, but now the roxitazone was withdrawn from the market because they have induced the liver proliferation. They expression in the liver, heart, skeletal muscle, and vessel. The next group is binding the alpha glucosidase to inhibit the absorption of the carbohydrate directly in the small intestine. They have a long to use is the glucobase or acarbose. And the new group is the dipeptidyl peptide 4 inhibitors. This is increase the GLP-1. They inhibit and increase this receptor dipeptidyl peptidase, inhibit glucagon release, and increase the insulin secretion, decrease the gastric empty, and decrease the blood glucose directly. And they have a little side effect in the nervous system, the gastric disease. This drug is used in the person who have the affect the kidney function. The kidney function is bad. The medical doctor selected to use in this group of the drug, and finally, the person who have the kidney failure, they use in the SGLT2 inhibitor to directly inhibit this receptor in the kidney. This a very new group of the drug that decrease the glucose level. They can decrease the hemoglobin A1C level, but they have risks in the acute kidney injury. This figure, and thank you from this lecture.